Cervical cancer is something we can often detect early, and catching it early truly changes outcomes. As a physician, I've seen people overlook subtle signs, and I've also seen how timely action spares hardship, for health and for families. Today I'll guide you through 5 symptoms that deserve attention, so you can look after yourself, or someone you love, with confidence. We'll cover what each sign might mean, why it matters in the body, and the exact next steps to take, including the tests to ask about. Let's start with the first. Abnormal vaginal bleeding, after sex, between periods, or any bleeding after menopause, deserves attention. These patterns are not just normal if they are new for you. Biologically, cervical tumors or precancerous changes can make the cervix fragile and disrupt tiny blood vessels. Light contact, like intercourse, or hormonal shifts can then trigger spotting or bleeding. What to do? Note when it happens, how much blood, presence of clots, any pain, and whether it follows intercourse. If you are postmenopausal, treat any bleeding as a prompt reason to be seen. Book an appointment for a pelvic exam, Pap and HPV testing, and, if needed, colposcopy. Next, watch for unusual discharge. It can offer important clues. Unusual vaginal discharge that is new, persistent, or clearly different from your normal, more watery, tinged with blood, or with a strong odor, deserves attention. Biologically, cervical inflammation or early lesions can ulcerate tissue and disrupt mucus production, creating watery or blood-tinged fluid. Unlike many common vaginal infections, discharge related to cervical disease may persist or recur despite over-the-counter treatments, and may be mixed with spotting or pelvic discomfort. Track details: when it began, how often it happens, color and consistency, amount, odor, and whether there is pain after sex or bleeding between periods. At your visit, ask about a pelvic exam with a speculum, Pap and HPV testing, swabs for infection, and, if the cervix looks abnormal, colposcopy or biopsy. If initial tests are normal but your symptoms continue, schedule follow-up promptly and ask about referral to a specialist. Do not wait. Acting early protects your health, and we are here to help you navigate each step. Next, let's talk about pelvic pain and pain during intercourse, another important sign to recognize. Persistent pelvic pain, or pain during sex, dyspareunia, can be a symptom of cervical cancer. If pain is new, persistent, or simply different for you, please get evaluated. It is absolutely okay to talk about sexual pain. It's a legitimate medical concern. You do not need to feel embarrassed. Lesions on the cervix, inflammation, or nearby tissue stretch can trigger localized pain by irritating nerves or putting pressure on surrounding structures. In clinic, we start with a careful history, then a pelvic exam. We may add tests as needed: Pap and HPV if due, pelvic ultrasound, and MRI when indicated. If pain persists or findings are concerning, ask for referral to a gynecologic oncologist. Next, let's talk about changes in menstrual patterns. Heavier, longer, or irregular bleeding compared with your personal baseline, especially if it's new or worsening, can signal a problem that merits evaluation. Track your cycles with a calendar or app. Note start dates, flow, clots, and cramps, because patterns over weeks to months tell us a lot. Biologically, cervical lesions can disrupt the surface and nearby vessels, making the cervix fragile and prone to bleed. Inflammation can also interfere with normal lining shedding. Of course, hormones, thyroid changes, or fibroids can also alter flow. We sort this out with history, exam, pregnancy testing when relevant, Pap, HPV, and targeted imaging or labs. When you see your clinician, share cycle length and variability, number of pads or tampons, and any fatigue or shortness of breath suggesting anemia. Early detail speeds answers. Next, we'll cover other symptoms to watch for. Later symptoms include blood in the urine, changes in bowel habits, unexplained leg swelling, or unintended weight loss. These usually point to more advanced disease and are not early, subtle warning signs. They can suggest involvement of nearby organs or impaired lymphatic drainage. Next steps, we shift from screening to diagnostic workup, urinalysis and stool tests, blood work, and cross-sectional imaging such as CT or MRI, with early referral to a gynecologic oncologist. If any of this sounds familiar, contact your clinician now. Earlier evaluation is safer. You deserve timely answers and care.